Hello everyone, welcome to my channel Physiotherapy Online Lectures. Today we are going to study one of the most important chapter or topic of anatomy is joints. Now before moving to the main topic, uh, we want to also discuss about the objectives of studying this chapter. We will study the classification of joints, definition of joints, and description of the each and every joints. Okay. Now comes to the definition. In general uses, we use the term joint as a place where two things are joined together. In this anatomical uses, the joint is a junction between two or more bones. The long bones articulate by their ends, the flat bone by their margins, the short or irregular bone by their surfaces. Okay. Now, next part is the classification. The most important topic which comes in the physiotherapy BPT first year examination in anatomy is the classification of joints. The joints can be classified according to their structure and functions. Okay, so number one is the functional classification. In functional classification, it is based upon the degree of mobility of the joints. They are of three types. One is immovable types, immovable joints, or that is known as synarthrosis. Number two is slightly movable joint, that is ampliarthrosis. Number three, free movable joint, that is diarthrosis. Okay. Now the immovable joint or synarthrosis, which shows no mobility, is the joint which shows no mobility. Such as example are the cranial sutures in adults and the primary cartilaginous joint in the growing children are the immovable or synarthrosis joints. Number two is the slightly movable joints, which is known as the ampliarthrosis, which shows some degree of mobility. That, as per example, is the secondary cartilaginous joints or syndesmosis. Okay. And number three, freely movable joint, that is diarthrosis, which shows maximum degree of movement, such as synovial joints. So these are the classification according to the functional classification. Okay. Now the structural classification. The structural classification, it is based upon the types of the connective tissue and the presence or absence of the joint cavity. The structural classification is based upon the type of connective tissue, such as connective tissue such as fibrous or cartilaginous, and also on the presence or absence of the joint cavity, such as in the synovial. Okay. Number one, under the structural classification is the fibrous. Number two, cartilaginous, and number three, synovial joints. And in clinical practice, the structural classification is most commonly followed. Okay. Number one is the fibrous joints. Okay. In here, the bones forming the joints are united by fibrous connective tissue. The bones forming the joint are united by the fibrous connective tissue. These joints are either immovable, it may be movable, or permit only a slight degree of movement. The fibrous joints lacks joint cavity. Okay, these are the most important points. The fibrous joints are of three types: sutures, syndesmosis, and gomphosis. And the fibrous joints are of three types: sutures, syndesmosis, and gomphosis. The sutures, the articular surface are connected by a thin layer of connective tissue, that is sutural ligament. These joints are confined to the skull only. They are peculiar to the skull. They are immovable in nature. That in growing children they may permit a little mobility. Depending upon the shape of the articular surfaces and the margin, these joints are further divided into the subtypes. These sutures are further subdivided into the subtypes such as plain suture or number one. Here the articular surface are plain and fairly smooth, such as median median palatine sutures, where the paired maxillary and palatine bone. The median palatine suture is confined between the paired maxillary and the palatine bones articulate to form the hard palate. Okay. Number two is the serous suture or limbus suture. Here the articular surface of the suture are reciprocally serrated and interlock with each other in the jigsaw fashion such as sagittal suture. Number three is denticulate suture. The margin of the sutures interlock with each other like a teeth of saw, such as Lambert suture. Number four is squamous suture. The articulating surface of the suture are relatively flat and overlap with each other, such as suture between the temporal and parietal bone. And number five is syndialysis. It is a specialized suture where a ridge of one bone fits into the group of other bone. As for example, joint between the rostrum of the sphenoid bone and the cleft between the alae of femur bone. Okay, so these are the types of sutures. Okay, so here we can see from the picture. You have to draw in the examination these pictures. These are the fibrous type of joint, cartilaginous cell, and these are the synovial. You have to draw in the examination. Okay. Here the sutural ligament. Here you can see in between the two bones of the skull. Next one. These are the plain sutures. These are the plain suture, serrate suture, denticulate suture, okay, and squamous suture, and syndialysis. Syndialysis is the rostrum of sphenoid and alae of femur. Number two is syndesmosis. Yeah. These are the joints where two adjacent bones are linked together by a considerable greater amount of connective tissue than in the suture. In the suture, there is only small thin amount of connective tissue, and here considerably greater amount of connective tissue are present in between the syndesmosis types of joints uh, in the form of interosseous ligament membrane, such as interosseous radioulnar joint, interosseous tibiofibular joint, and inferior tibiofibular joint, and joint between the adjacent laminae of the vertebra. Okay, these are the syndesmosis type of joint. Here are the example of syndesmosis. See, you have to draw the syndesmosis in between the distal tibia and distal fibula. And number three is the comphosis, which is also peg socket joint. This is a specialized fibrous joint restricted to the fixation of teeth in the alveolar socket of the mandible and maxilla. The root of the teeth is attached to the socket within the alveolus by periodontal ligament. It is known as the comphosis. Okay. Here is the picture of the comphosis. Next one is the cartilaginous joint. Number 2. Here, number 1 was the fibrous joint. Under fibrous, there are subtypes as suture, syndesmosis, and composite, and there is subtypes under the sutures also. And next one is the cartilaginous joint. The cartilaginous joints are those joints in which the bone forming the joints are united by means of hyaline cartilage or fibrocartilage. Okay, the cartilaginous are also lack of joint cavity. The cartilaginous are two types: primary cartilaginous joint, which is known as synchondrosis, and the secondary cartilaginous joint, known as symphysis. Okay, now comes the primary cartilaginous joint or synchondrosis. The, the bones or parts of the bones forming the joint are joined by a plate of hyaline cartilage. As for example, joint between the epiphysis and aphysis of growing long bone, and joint between the basiphonoid and basiocciput, the spheno-occipital joint, and first costosternal joint. These are the primary cartilaginous joint. Now, the secondary these joints are immovable, mostly temporarily in nature. Okay, and next one is the secondary cartilaginous joint. Is known as symphysis. In this joint, the articular surface of the bone forming the joints are covered by thin plate, which is known as the hyaline cartilage, which are connected by a disc or pad, or known as fibrocartilage. As for example, is symphysis pubis in between two pubic bone, intervertebral discs between the bodies of the adjacent vertebra. Number C, the manubrium sternal joint between the manubrium and the body of the sternum, and last one is the symphysis mentae in between two halves of the fetal mandible. Okay, here are the difference between the primary and secondary cartilaginous joints. Okay, primary cartilaginous bones are connected by hyaline cartilage. Secondary bones are covered by hyaline cartilage, and the connective tissue by the fibrocartilage. The primary cartilaginous joints are immovable in nature, and secondary are slightly movable. Primary are disappear with the age. Secondary does not disappear with the age, and primary cartilaginous joints rarely occur in midline of the body, and secondary always occurs in the midline of the body. Okay, so next we go for synovial types of joints. Out of all the types of joint, the synovial types of joint are the most common in the body and for the most important clinically. The synovial types of joints, these joints possesses a cavity on and the articular ends of the bones forming the joints enclosed in a fibrous capsule. Okay. As a result, they are separated by a narrow cavity called the articular cavity or joint cavity, which is filled with a fluid called the synovial fluid. The joint fluid is like the L-promin. Here the name is the synovial joint. The synovial joint are most evolved and freely movable joint, so often termed as the diarthrosis joints. Okay. The features of the synovial joint. The articular surface are covered by a thin plate of hyaline cartilage. The joint cavity is involved by a articular capsule which consists of an outer fibrous capsule and inner synovial membrane. The cavity of the joint is lined everywhere by synovial membrane except over the articular cartilage. The cavity is filled with synovial fluid secreted by synovial membrane. 5 is sometimes the joint cavity is incompletely or completely divided by the articular discs or meniscus. Some additional structures are present within the joint, such as fats or tendons. Okay. The components of synovial joints and their significance. The components of the synovial joints are the fibrous capsule. It is completely invests the joint like a sleeve and encloses the synovial cavity. Okay, it is attached by a continuous line to the bones, forming the joint close to the articular cartilage. It consists of longitudinal and interfacing bundle which of the connective tissue fibers. The fibrous capsule along with the synovial membrane together forms the articular capsule. What are the functions of the fibrous capsule? The fibrous capsule stabilizes the joint in such a way that it permits movement but resists the dislocation of the joint. Number two is the numerous sensory nerve endings ramify on the capsule. The stimulation of these nerve endings produce reflex contraction of the muscle acting on the joint in such a way that the joint is brought in a position of maximum comfort to protect the joint. That is known as watchdog reaction of the capsule. Number two is ligament. After the fibrous capsule, number two is the ligament. This is a thickened band of collagen fiber. There are two types, true ligament and accessory ligament. On the true ligament are the local thickening of parallel fiber bundles of the capsule ligament is not separated by the capsular ligament, such as intrinsic ligament, medial and lateral collateral ligament of the knee joint are the example of the true ligament. The accessory ligament are separated from the fibrous capsule, may be extracapsular or intracapsular. The stylomandibular and spinomandibular are the example of the accessory ligament. Number three is the synovial membrane. In case of diagrammatic picture of the synovial joint, we have to draw this. Okay. In diagrammatic picture, you have to draw this picture for the synovial joint. Next one is the synovial membrane and articular cartilage. It's a articular discs or meniscus. Number 5. Number 6 is bursa and fat pad. Okay. Now, a classification, important part, the classification of the synovial joint. The synovial joint classified number A is according to the shape of the articular cartilage. Shape of the articular surface. Okay. Number 1 is plain joint. Here the articular surface are nearly plain in nature. Okay. Yes, they permits gliding movements in various directions, side to side or back to forth movement. Okay. As example, intercarpal joint, intertarsal joint, intermetatarsal joint, intermetacarpal joint, and joints between the articular the adductor. Next one is the hinge or joint. The articular surfaces are fully separate. Movements are permitted only in one plane around the transverse axis, much like the hinge of the door. These joints have strong collateral ligament to prevent the other movement. Okay, the hinge joint are most common type of synovial joint, such as elbow joint, interphalangeal joints, knee joint, and ankle joint. Number 4 is the pivot or trochoid joint. The articular surface of one bone is rounded. Here, the articular surface of one bone is rounded in nature and fits into the concavity of the another bone. Further, the rounded part is surrounded by the ligamentous ring. Okay. The movement in a pivot joint has limited rotation around the central axis. Example is the superior radial joint. Okay. Number 4 is the condylar joint. The round articular surface of one bone fits into the socket type nature of the another articular surface of the another bone. The end of the bone bearing round articular surface is called the condyle. Okay, such as right and left temporomandibular joint and knee joint. And next one is number 5, ellipsoidal joints. The elliptical convex surface of one bone articulates with the elliptical concave surface of another bone. That's known as the ellipsoidal joint. Such as flexion extends around transverse axis of the abduction and adduction around. Thus, these movements occur. That's the diagram of the pivot joint. Okay. Example, as per example of the pivot joint are the radiocarpal joint, atlanto-occipital joint, metacarpophalangeal joint, metatarsophalangeal joints. Okay. Next one is the number 6, saddle joint. The articular surfaces are reciprocally saddle shaped or concavo-convex shaped. This unique articulation is modified condylar joint that allows the wide range of movement. The example are the first metacarpophalangeal joint, most important here. First metacarpophalangeal joint is the saddle joint. Next one the sternoclavicular joint. Number C is the calcaneocuboid joint and the inducomalleolar joint is the smallest saddle joint. And last is the ball and socket joint or spheroidal joint. It is rounded convex surface of one bone fits into the cup-like socket of another bone. The movement occurs around a definite number of axes. Thus, the type of articulation provides the greatest range of movements in all directions in the case of synovial joints, such as hip joint, shoulder joint. Okay. The example of various synovial joint according to the surface is the schematic diagram of ellipsoidal joint, schematic diagram of saddle joint. Okay. You have to draw a schematic diagram of the condylar joint. All I have to draw. Okay. Now, next classification of the part according to the plane or movement. It is either uniaxial joint, uniaxial such as hinge joint or pivot joint are uniaxial, and next one is the biaxial, biaxial such as condylar joint are the biaxial, and ellipsoidal joint are the biaxial, and saddle joint are the biaxial movement. And number 3 is the multiaxial or polyaxial, such as, and number C according to the number of articulate bone. The simple joint such as interphalangeal joint of the fingers, compound joints. There are more than 2 bones take part in the formation of a joint, such as ankle joint, where 3 bones form tibia, fibula, and talus. Elbow joint, where 3 bones, humerus, radius, and ulna. Radiocarpal joint or wrist joint, here 4 bones, radius joint, scaphoid, lunate, and triquetral take part in the formation. These are the compound joints. Okay, these are the schematic short table shows the various type of synovial joint according to the articular surfaces. Okay. Here are the movements of the synovial joint: gliding movement, angular movement, and rotatory movement. And gliding movement, slipping movement, and the angular movement are the flexion, extension, abduction, adduction, and 2 basic circular motion are the rotation, supination, and pronation. Okay. So these are the blood supply of the synovial joints. It is derived from the periarticular network of the arteries that is known as the circulus articularis vasculosus that surrounds the joint. Okay. And nerve supply is the sensory nerve fiber conveying pain, sensory nerve fiber conveying proprioceptive sensation, autonomic fibers which has vasomotor effect. The innervation of various structure of a joint is as under. Capsule is innervated by the encapsulated nerve endings or rufinis corpuscles and free nerve endings. Thus, encapsulated nerve endings and free nerve endings. Number B, a ligament is supplied by pain-sensitive free nerve endings. Synovial membrane is innervated by vasomotor sympathetic fibers and pain-sensitive free nerve endings. And articular cartilage has no nerve supply. Most important, articular cartilages are insensitive except at the attach of the margin. Okay, so here comes the most important topic of anatomy, which frequently comes in the examination, is the joints. Okay, for today, thank you.